Good afternoon, everyone. So in this training program, today we will discuss lab safety. This is very important, how we are maintaining our lab, and this is also the requirement of your ISO 15189 also. It is mentioned in clause 6.3. You have to maintain your environmental condition. You have to think about lab safety also. Okay, so now what is important? We will discuss in these things briefly. Laboratory safety. This laboratory safety includes person protection also, infection control also, housekeeping. A good housekeeping is important, and biomedical waste management also. In addition to these, what are the other things which are important? Fire safety, electrical safety, chemical safety, disaster management, and ergonomics. We will discuss briefly these things one by one. And there is a document, ISO 15190, that is safety requirements in medical laboratory, ISO 15190. So you can Google and you can get this copy of ISO 15190. If new edition is not available, then you can get old edition, but that hardly matters. But that is a good document, ISO 15190. There are a few other documents, Occupational Health and Safety Policy, 18,001, or Environmental Management, 14,001. You need not to read all these things, but if somebody is interested, these are also good documents. In this laboratory safety, we talk about patient safety. We talk about personal safety, people who are working in the laboratory. For this, you shall have documented safety policies and procedure. What we can say, laboratory shall have laboratory safety manual. You have to follow OSHA regulations, occupational safety and health regulation. OSHA means occupational safety and health regulation. And you ensure, at least offer, vaccination to people working in the laboratory, particularly against hepatitis B and COVID-19. These are the general safety requirements. People should follow guidelines of personal protective clothing and equipment, gloves, gown, mask, eye protectors, proper handling of spillage, whether it is some chemical spillage, blood spillage, or other body fluid, proper disposal of biomedical waste, keeping in mind your national, regional, and local guidelines. All occupational injuries and illnesses require medical treatment, and laboratory must contain a log for all occupational injury or illness that adhere to locally applicable regulation. Keep record of all occupational injury and take appropriate measure for that. Fire safety is very important. Laboratory shall have automatic fire extinguishing system and a fire bell whenever there is a fire, public address system, or other alarm system which is audible in all sections must be there. So whatever system you're following, see, different organizations, they have different size, different requirements. It is up to you. In big institution, you can install, you can get this smoke detector installed, then water sprinkler, or in small laboratory cylinders like this. But what is important, you shall have appropriate fire extinguishing equipments with you, and people shall be trained how to use that. Because this is important. Decisions shall be taken as early as possible. Sometimes this may happen. Some person may have some hearing problem. So how he will get the information? Some visual alarm system. This fire training must be held often. When we say at least once in 12 months. And ignitable liquids must be stored as per the required guidelines. People working in the laboratory, they should know how to use this. And it is important. If suppose 15 people are working in one laboratory, in one hall, it is not required that everyone shall be trained in this. But they shall have good training. Whenever you will get this alarm, what is important? You have to rush outward, following proper guidelines. So they shall be trained for that. And good training, then training certificate also, and periodically monitor whether they still know the concepts or they have forgotten everything. Then retraining is required. So at least this training shall be performed once in 12 months. So these are the different abbreviations we use. Some common materials such as paper, wood, or if suppose flammable liquids such as gasoline or paint remover, etc. B category, electrical fire, C category, combustible metals, D category. Appropriate measures shall be taken following fire extinguishing guidelines. Electrical safety is important. Appropriately grounded. Check for current leakage before initial use or after any repair, or whenever a problem is suspected. And you follow general guidelines like multi-plug shall not be used to fix multiple plugs in one socket. You shall have sufficient number of sockets. Then don't try to fix naked wire with the help of matchstick, or naked wire is there, wire from instrument to electrical socket, trolleys are moving over that and the wire may get damaged. All these things you have to keep in mind. A big institution, if you have biomedical engineers, electrical engineers, they are regularly checking all these things, and these monitoring shall be appropriately documented. Chemical safety is very important. Laboratory shall have comprehensive signage and labeling system. In this particular cabinet, you are keeping these chemicals. You maintain material safety data sheet for each hazardous chemical. And laboratory shall have a written plan to reduce or eliminate mercury. You shall have eyewash. Chemical fume hoods must be checked annually if they are working properly. One person may get chemical injury by inhalation, by skin absorption, or mouth pipetting, or eye contact. These are the different ways. And appropriate signages shall be there. If suppose something is corrosive substance or flammable material or explosive substance, appropriate signage shall be there. Then you shall have policies and procedure for assessing the occupational risk associated with exposure to infectious agents, because this is common in your microbiology laboratory. You shall have level 2 biosafety cabinet whenever you are working with infectious agents. This is very important, and we will keep one full lecture on this waste disposal, biomedical waste disposal. Sometimes what happens, a laboratory segregates infectious and non-infectious waste separately. But if you are mixing them, then 100% will become infectious. So this you have to keep in mind. You shall have documented policy and procedure. All solid and liquid waste must be disposed in compliance with applicable local, state, and national regulations. If you have sharp, especially those containing potentially infectious material, must be discarded in puncture-resistant container with tightly fitted lids. Disaster management is very important, and people shall have training for that. See, this 15189 is a global standard being followed in different countries. In some countries, earthquakes are very common, like in Japan. Or if you are close to sea, then you may get some problem. So you shall have training appropriate to requirement of your laboratory. So you shall have documented procedure of internal and external disaster preparedness. Dr. Anish, please unmute yourself.
Hello, sir.
Can you hear me clearly?
Yes, sir. Yes, sir.
Okay, right. So, Akaundi Shriram, please check your audio. Because any emergency may happen, like fire, flood, electrical problem, or spillage of hazardous volatile material, or earthquake, or mass casualty situation. So you shall have some plan for that according to the requirement. And appropriate evacuation plan shall be explained to people working in the laboratory, or you shall have proper signages so that people who are visiting laboratory, they also feel safe. Ergonomics means designing at your workplace. How your chair is designed, it is not putting excess discomfort to person who are working. Sometimes what happens in some laboratory, uh, these technical staff, if they are using stools to sit, either they are at very low down position or at very high position. Then they feel strain in their back. So this should not happen. This shall be designed in such a way, because sometimes if this is not designed properly in our laboratory, the people who are performing microscopy, then they feel little uncomfortable. See, the goal of the ergonomics is to fit the job to the person rather than making the person fit the job. And Bill Black very rightly said, if it hurts when you are doing something, don't do it. The laboratory shall have documented ergonomics plan. In this photograph, you can see this is not a comfortable position to work on the computer. Laboratory activities, workplace equipment like a chair, workstation, computer keyboard should be designed to reduce the risk of ergonomic disorders and accidents. After this COVID-19, everybody knows what is the meaning of personal protective equipment. According to the situation, according to the requirement, appropriate personal protective equipment shall be provided to person working in the laboratory. Eye protection, gloves, lab coat, footwear, emergency showers, eye washes, fire extinguishers. All these things are not personal protective equipment, but these things are for the personal protection, like fire extinguisher, eye washes. And when you're working in the laboratory, avoid use of contact lenses. Prefer to use spectacles. And on these, you can fit your these protective goggles. Use appropriate gloves to avoid contact with hazardous agent. And do not wear gloves in halls or elevator. Lab coat protects body. It should be non-flammable fabric. And whenever you're washing this lab coat, do not wash with regular clothing. You are using footwear. Don't use this chappal type things. Your toes are open. Closed toe shoes must be worn in labs, not sandals. And whatever footwear you are designing for the laboratory, that should be used exclusively within the laboratory. Emergency shower, eye wash, everybody should know what are the areas where you have these eye washes or emergency shower, and people should know how to use this. And wash for minimum 15 minutes with running water. Remove all contaminated clothing. Wait for medical assistance. Report incidents. And keep record of all actions taken. Infection control is important. We will have detailed lecture on this infection control in the time to come. Purpose is to reduce the risk of occurrence of infectious disease spread by human to human contact with infected surface, airborne transmission, or waterborne transmission. Proper cleaning of workstation, hand wash with appropriate detergent, and following proper hand washing technique. A proper procedure shall be followed, and you are using personal protective equipments, disinfection and sterilization of the work area. People shall be vaccinated, and people shall have awareness about this infection control. How they will get the awareness? Through the training programs. Good housekeeping is very important. How this housekeeping is defined? Housekeeping is defined as the provision of a clean, comfortable, and safe environment for the patient and laboratory staff. Regular and routine cleaning of all surfaces. High level of hygiene shall be maintained. And person who is performing this housekeeping shall be trained in how this different area shall be cleaned. Requirement will be different. This biomedical waste management, for this also we have a separate lecture. Here what we have done, we are discussing this lab safety. You can see overview of lab safety, what all is included in this lab safety. See, as we were discussing, the hazardous waste 10 to 25%, non-hazardous 75 to 90. The non-hazardous can go to municipal town. Hazardous may be infectious or other hazardous. Infectious is 15 to 18%. Non-sharp, sharp, plastic disposal, liquid disposal, and other hazardous, radioactive, discarded glass, pressurized container, chemical waste, cytotoxic waste. And we are discarding as per our biomedical waste. But if we mix these with the infectious, then 100% become infectious. And biomedical waste is defined as waste generated by healthcare establishment research facility, and diagnostic and testing laboratory. It should be segregated at all levels, collected in appropriate containers. When you are transporting, those shall have appropriate signages and color coding shall be maintained. And as they are showing these wheeled containers, so these are good. So this poly bag shall not be dragged, and these shall be disposed of properly, following appropriate guidelines. Why we are very particular about this biomedical waste management? We want to prevent the transmission of disease and to prevent the exposure of harmful effects such as cytotoxic, genotoxic, and chemical biomedical waste. See, these are the different categories of biomedical waste. Category 1, human anatomical waste. Category 2, animal waste. Category 3, microbiology and biotechnology waste. Category 4, waste sharp. Category 5, discarded medicine and cytotoxic drug. Category 6, solid waste. Item contaminated blood and body fluids such as cotton, dressing, plaster cast, line bedding. Now these 6 categories, we have 4 types of bags: yellow, red, blue, black. This blue or white is puncture-proof container. This category, different categories, they go in different type of bags, like human waste, animal waste, or microbiology, or solid waste, contaminated blood and body fluid. They go in the yellow bag. And when we will discuss this biomedical waste, then we will discuss these things in detail. See, what is important, what you have to understand. One thing is, laboratory shall have a registration with State Pollution Control Board. What is the meaning of this? They are authorized by that State Pollution Control Board to generate biomedical waste in their laboratory. Then they are collecting waste appropriately, properly segregating and collecting. Then these laboratories shall have a contract with service providers who is collecting biomedical waste from their laboratory and disposing of appropriately. One thing is registration with State Pollution Control Board. Second is registration with appropriate authority which will collect waste from your laboratory. And that body which is collecting waste shall be approved by State Pollution Control Board. Check that certificate also. One thing is valid registration with State Pollution Control Board, valid registration with the body which is collecting, and that body shall be approved by State Pollution Control Board. And this you have to see everything is working smoothly so that there is no hazard of infection in the community. This is very important, and this is a mandatory requirement which is otherwise punishable by law. And everyone shall follow appropriate biomedical, this appropriate personal protective equipment so that there is no hazard. As we were discussing, dedicated wheeled container, trolley or cart should be used. It is not dragging of poly bags. And also design waste route. in your organization how this waste will be transported. So avoid those areas where you are handling your patients when you are transporting this waste. And this untreated biomedical waste shall be transported only in authorized vehicles. And those shall be appropriately labeled. Now you can see in this, there is no personal protective clothing, overloaded tray, excessive spillage of waste. This should not happen. When you're transporting waste, it should be appropriately done so that it is serving the purpose of this activity. Transportation is away from patient care units. This you have to keep in mind. So now what is important? Monitor the method by which biomedical waste is collected and disposed. Display the chart for color-coded segregation of biomedical waste. Arrange training for the lab and housekeeping staff regarding biomedical waste management. Now, can anybody tell me what is the difference between education and training? Anyone? Please write in the chat box, then I will unmute you. What is the difference between education and training? Okay, no problem. Now, what we have studied today? What are the international standards followed for safety? We discussed what are the different categories of safety practices followed. List of different categories of fire. Some of the PEP used in the laboratory, color codes for disposal of biomedical waste, or you can say accreditation body requirement for waste management. What are these international standards? Occupational Health and Safety Policy 18,001, Environmental Management 14,001, and there is one ISO document also, ISO 15190. Different categories of safety practice: general safety, fire safety, electrical safety, chemical safety, disaster management, ergonomics, and disposal of biomedical waste. These are the different categories of fire which we discussed. Common material, then flammable liquid, then electrical fires, then combustible matter. Eye protection, these are all for protection, eye protection. Gloves, lab coat, footwear, emergency showers, eyewashes, fire extinguishers. Color coding of the biomedical waste management. And how this shall be managed? One thing is registration with the Pollution Control Board. Second, registration with the waste management body. And third, this waste management body shall be approved by the State Pollution Control Board, and they should follow appropriate guidelines. And a personal protective equipment shall be used. Thank you.